But I'll start by introducing Maria. So I'm going to introduce you, I think.
Thank you.
And this is Maria Brennan Thorns. She's Qutis Clinic's owner, founder of the business. Maria founded Qutis, 32 years ago. 25 years ago. We started a clinic in Tame, and then about 10 years ago opened a clinic in Witney, which is North Oxfordshire, and then 2 and a bit years ago we opened the clinic where we are at today, which is in Pickett's End in Hemel Hempstead. Maria is an independent nurse prescriber with her master's degree in nursing and leadership. So she has the equivalent, I suppose, education as a junior doctor, but her experience is that of a consultant because she has 30 plus years of aesthetics behind her. And hence why she'll lead the event, and she's my mentor.
So thank you for that fab introduction, Ange. Ange and I have worked together for 10 years, and Ange is now our senior nurse business manager. So she does a little bit of everything, and she runs the business, and she's very, very specialised in Coolsculpting and non-surgical facelifts and all of those treatments, and we get to work together on Thursdays, so it's a perfect time for us to say hi to you guys in our lunch and run one of these events. So today is going to take about 30 minutes. It's like a slide presentation, and we go through some of the things that you might have wanted to ask if you're an existing patient of ours, or you're interested to know about if you are thinking of being a new patient of ours. So we welcome you all, and we hope that this is focused on it being broad for new people and existing people alike. So we'll go to the next slide. So we captioned this title of the Qutis Non-Surgical Facelift. In fact, we designed the non-facelift because with our 25 years of experience, we know that there are more ways to skin a cat. So if someone is wanting to look facially better for their age, or as good as they can for their age, it's not just going to be one thing. It's going to be a combination of things. So the Qutis non-surgical facelift is combined treatments to treat the whole of the face, the jaw and the neckline, and also we take into consideration what your direct wishes are, and we will say what's possible and what's not possible. But within the combined therapies of the Qutis non-facial non-surgical facelift are cosmetic injections, light and heat, and clinical skincare. And all of those are very important in order to get a good, pleasing, all-round result. So we just got one person to let in. Welcome for the person who's just come in. We're on the first slide. So we're talking about the non-surgical facelift being combined treatments, and it's a universal approach. Instead of, when I first started 25 years ago, we would just maybe concentrate and focus on a nose to mouth line or lipstick lines, whereas now we understand our patient group even better, and we understand that it isn't so pleasing for the individual if they just have one part of their face and not the whole of their face. So what we're trying to do with the aging skin, we're trying to restore lost volume, and we tend to lose volume down here at the side of the mouth and underneath the eyes where the tear trough separates from the cheek. And also in the cheeks, and the volume is lost as we get older due to many things. So it can be down to genetics, it can be down to the environment, so ultraviolet light and the life that we've lived, whether we work outdoors or indoors, whether we put weight on or lost weight or always been skinny, whether we're a hyper exerciser. All of those things are how we age. So Our Qutis non-surgical facelift obviously is not surgery. It's the combination of injections, light heat, and clinical skincare. And the good thing about it is it's customized for each and every one of you. So we will see you first on a virtual consultation or a face-to-face consultation, listen to you and see what your goals are, your treatment goals, and then we'll explain everything. However, because this is not a consultation, it's a webinar to inform, we're going to give you a lot of the information in this now, which we hope will save people time.
And I think ultimately what makes this a Qutis non-surgical facelift is our fundamental goal is to maintain your natural best. So we want our patients to look their natural best, healthy, fresh, glowing.
Yeah.
And that fundamentally is why we say we look at the whole face, because that is really what helps us enforce that natural look.
And in the nurse education, in the qualifications that we have, we are taught and trained to be very person-centered. And I had a patient just yesterday who put this into words really well. She was moving practitioners, unfortunately for the other practitioner, to us. And she said she felt that her previous practitioner had been focused more on the treatment and not so much on her as the individual. Now, the truth is we have to be well qualified and skilled enough and competent to focus on the treatment, but the individual must be coming all the way with us.
Yeah, it's very much a journey we take together with our patients.
Welcome for late joiners. We're just on the second slide. You haven't missed very much. We've just explained that the Qutis Clinic's non-surgical facelift is a combination of injections and light heat energy treatments as well as clinical skincare. So this slide, what are dermal fillers? This is something that Angela and Paula Sherrick and myself are answering and being asked each day of our working lives. What exactly is it? This morning I consulted with a lady who is a practicing Muslim, and she was wanting to make sure that there is not any animal products in dermal fillers. And I'd like to share with you recent questions that have been asked. May I assure you this is not. This is a natural product which is hyaluronic acid. Now, everybody, some people may think acid, ooh, isn't that something that burns? Well, don't forget, lemon juice is acid. It's really where it is on the pH scale of acid or alkaline. But hyaluronic acid is a natural component that is made in our bodies each and every day. And we make it in our skin, it's in the fluid of our eyes, it's in our joints to lubricate, and it's what makes our skin, if you think of a baby skin, it makes our skin nice and cushioned. And it's hyaluronic acid is a water-loving molecule, so it will draw tissue fluids towards it, giving a nice sort of healthy and bouncy look to the skin. So we make our own. Every 24 hours we make some, and every 24 hours we lose it again. And as we get older, guess what happens? We don't make so much of it so quickly. So think of hyaluronic acid as being something natural. It's in large amounts in the body. And when we inject it as dermal fillers, we're injecting it to replace the body's own hyaluronic acid. And it's a natural thing that sits very easily in the skin tissues, in the skin matrix. So on the slide that you're looking at, where the blue molecules are on the top, that is hyaluronic acid that is lubricating the skin, and then you can see that it's in the different layers, and that on the third one across, you can see that it's integrating very well into the dermal matrix of the skin. So, how do we lift the face without surgery? Well, we do some really clever things. Angela and I have been on many continuous professional development courses with plastic surgeons, and quite often plastic surgeons are our mentors and are teaching us on how to address skin and facelifting using dermal fillers and knowing where to put them in which compartment and which type of filler to put in which compartment to lift. And of course, there is less of a recovery time with something like we do with the Qutis non-surgical facelift than there is with surgery. Now, surgery definitely has a part in facial rejuvenation, but more people are not choosing it nowadays, and they're choosing to have dermal fillers. Now, this is really unknown why, but we can hazard a guess that it's to do with reduced downtime and that sort of thing. So with dermal fillers, it does create a subtle and three-dimensional effect rather than a pulled tight look that you can get with the old-fashioned surgical facelifts. So it's quite clever. You'll know that if you have nose to mouth lines here, it starts up here, because if you pull along like that, you'll make them look improved. And that's really how we actually do the lifting. So we take the skin like that and we inject a small amount, as much as a pearl, into the skin, and we inject it to pin up the skin and to act like a glue. And there's an immediate and corresponding improvement here. And we will look at that, show the patient that we're working on exactly what is improved, and that's how it's done, and likewise around in this area as well. So this slide shows how we can combine Botox as well as fillers in the many areas. Now, along here, most of the lines that are caused in the forehead, there are lines of expression, so the constant moving of the forehead and around the eyes. So it's muscles that causes those little lines and creases. So we use Botox up here because we're not looking at volumizing a forehead, we're looking at resting the muscles of the forehead. So these muscles work very hard and have done since birth to now. And so obviously over time, the constant moving of the muscles, whether it's like this or like that, is going to cause little fractures in the skin. And these are the lines that we don't like. The transverse forehead lines, the number 11s and the crow's feet. But down here is where we see lax skin and sagginess and crepiness, and that is caused by the underlying ligament structures which stretch over time. And the saying going south, well, that's what happens because all of the soft tissue structures that are sitting on top of the skull are stretching. So what we do is we replace volume, and sometimes we replace it by applying a wedge of dermal filler, and then sometimes we lift by applying a glue-like pin of dermal filler, and likewise for here and here. This is something that if you look at this presentation after we finished and you look on our YouTube channel, you might want to have a little look at this as to know where does the dermal filler go, where does the Botox go.
Yeah, I think one of the most common questions is what is the difference between Botox and dermal filler? And Maria's just explained it, sort of to summarize. Botox relaxes a muscle, so it doesn't erase a wrinkle or plump like a dermal filler does. Botox relaxes the muscle to stop, if you think of a piece of paper folding over and over, so it prevents the wrinkle from becoming deeper because it stops the muscle from working, which typically works naturally and in a positive way on the upper face. And in fact, there's a lot of clinical research that supports that this improves mental health, in particular depression in people, because it stops the frown muscle, which has a negative connotation sometimes, from working, and consequently it can make someone just feel a bit more positive. And we get that verbal feedback from our patients a lot.
So we heard it before it was proven, didn't we?
Yeah.
Because we sort of like looked for the science once we'd heard it enough, and the science exists. That there have been studies, they're American studies, but where they've been proven to people have registered that they have a better mood. So these things we sort of know, but until studies are done, it's not proven. But here we are, a bit of evidence for you. So here is a sort of prompter slide for the next slides, but here is one of our Qutis clinic patient ambassadors, and she came to us before with some of those life changes that many of us will know about that happen in midlife. It could be a new relationship, it could be a divorce, you know, heaven forbid, it could be a bereavement. But certainly with women, and so also with men, but you know, for if there are any men out there, the majority of our patients, they are women, but we do treat men. So we are repeating to you what we hear the most. We're hearing from people, it's now time for me. And I've given so much to my family, and I've given so much to my occupation, and I've given so much to my husband or to my parents, that I now want to do something for me. And this is exactly what this patient wanted to do. And the top left is her before, and the top right is her after. So she did have the Qutis facelift, and she's kept it up. So she comes back yearly for wee top-ups. She probably never has to spend the same expenditure as the first time because she comes back regularly to have a little bit now and then. But it really, I think, gave her a bit of swagger in her walk coming into the clinic, a bit foxy, and she felt very much elevated in her self-confidence.
Can you explain to the audience the time duration and how many treatment sessions this patient had between her before and after photograph to set expectations?
Yeah, 8 to 12 weeks and 2 or 3, I can't quite remember.
Yeah, this was 3 treatment sessions, and they were staggered 3 to 4 weeks apart. We like to leave a minimum of a 3-week gap between treatment sessions because it gives the body time to just relax, heal, recover to see a true result before we go on to the next stage. And yeah, she's maintained it through facials and things, isn't she?
We did forget to say this at the beginning, but I'll just say it now as it's come to me. There will be a chance to ask questions at the end, and you can. How do they do the questions?
So you can. There's an option at the very bottom, and where there's a chat room, and you can just type the question. It will come up as anonymous. I'll read them out, and then Maria and I will take turns responding to them, whoever can. And for all of those late attendees, we are recording this, and I will email it to you all. I've just admitted to somebody else, so I'm going to start again. For all of these late attendees, I'm recording this, and I will email it to you all as soon as we've finished the event, most likely tomorrow afternoon. And if your camera is on, if you could just kindly select the off camera at the bottom left-hand side of the screen, that would be appreciated. Thank you very much. Over to you, Maria.
So we're now on slide 7, how we use injectables. So Dermal Filler is a smooth injectable gel containing hyaluronic acid, and this is hyaluronic acid that is made in a pharmaceutical-like environment, in a laboratory environment, but it mimics the hyaluronic acid that is found in the skin. So the use of injectables is designed to replace the hyaluronic acid that you have lost. And it does this by filling the space of the volume loss, and you get an immediate improvement. And because it's a hydrophilic molecule, water-loving molecule, it will attract water to it. So you get a continuing and improving effect, maybe about a month after you have your treatment, as well as the instant effect. So fillers fill spaces, and fill and replace lost volume, and Botox will gently relax muscles around the frown lines, the eyes, neck bands, and we use Botox for medical things as well, medicinal things as well, like there is a protocol that we do for migraine headaches and for excessive underarm sweating, which both are classed as medical treatment, but we do them at our clinics. Oh, and jaw clenching.
I had a patient recently who had a really prominent masseter muscle, and she was speaking to her dentist about potential for surgery because her jaw clenching is bothering her so much, literally keeping her up at night and disturbing her both work and personal life. And she's under a lot of stress. which can cause additional jaw clenching. But she didn't realize that we could very simply, and it's quite straightforward, relax that muscle and consequently relax the jaw. She can still eat and everything, obviously, but it just relaxes that excessive muscle use to make her quality of life much better, and it's had a really positive impact on her. But it's something that I think we kind of don't talk about enough.
We don't.
And we can do that. Yeah. It has a cosmetic impact as well, but it's a very softening of a very square jaw, and it just rounds, it just softens it ever so slightly. Another point, and I might be jumping ahead slides, but we use different dermal fillers on different areas of the face. Maria said that hyaluronic acid is a water-loving molecule, and it absolutely is. But the beauty of the dermal fillers that we use, they have a different range of something called hydroxity, which is how much water that molecule attracts. So for example, we would put something in the lips that's really attracted to water, or that's going to attract a lot of water because we want to plump them. Whereas in the eyes, we would put something that doesn't attract too much water because we don't want swelling and we don't want to attract a load of water in this area. So we choose our dermal filler very carefully depending on what our goal is for the face.
This is what everyone asks, is what happens to Botox and to fillers over time. So Botox works by putting the nerve to sleep over a period of weeks.
That's it.
Someone should be mute and they're not. Sorry, if you could mute yourself.
Yeah, they've said I've torn the muscle around my hip or the joint.
I'm so sorry.
Stay home, but I said no, I'm not going to because Nathan's on holiday and we have very short staff. So.
Hello, some of you are not on mute and we can hear your conversations. Could you just mute yourself on the screen?
There we are. Sorry about that, everyone. Technology.
So Botox puts the nerve to sleep. And don't forget, it's not one nerve, it's many sub-nerves, like little branches of nerves. And the nerve recovers, always recovers, and the lines reappear. So this is something I think that should take the fear out of Botox, that the nerve will always recover. And we're clever with the way we do our Botox. We don't go for paralysis. We go for segments of muscles putting to sleep while segments are still working. And the perfect treatment is that you can still do that, but you don't have lines. And a less perfect treatment is where you just look like you can't move. And that is something that we don't like to do. And we will try to talk anybody out of it who says that that's what they like.
Yeah, I suppose it depends on, it's a journey that we go through with our patients, and it depends on our patient's ultimate goal. And then we just educate and explain how we can achieve that through a natural result. Typically, and then we would document it as we go.
So the nerve recovers, the Botox gets taken out of the system via metabolism after it's done its job on the nerve, and the nerve recovers. Now, dermal fillers soften in time and exchange a hyaluron molecule for tissue fluid molecule, and the immune system metabolizes it. Botox lasts about 12 to 24 weeks, and dermal fillers last about 6 to 18 months. But what we have noticed is that although we are saying that fillers last up to 18 months, the more that you have, the less that you need. And there is some sort of residual impact of having had fillers. So I've had fillers for 25 years. And I've had very few fillers over the last 2 years. I've had a little bit of biostimulation, which is a different thing. But, you know, I've got to a point of having it frequently. And we speculate that it's about the fact that dermal filler's gone into the tissue, delivered through needles or cannula, and, you know, it wedges the tissue. And then the tissue forms its own sort of if you like, collagen by it being constantly stimulated.
And I think another thing, and this might be a question that will come up at the end, but I certainly get it a lot during face-to-face consultations, is what happens when the treatment wears off. It doesn't happen overnight. You don't suddenly wake up dropped from where you started. It's very gradual, as is your natural loss of hyaluronic acid or the movement of the muscle. You know how it's a gradual thing. You watch your face age. It's the gradual thing with the treatment results wearing off, which is why we just say little and often to maintain a natural look and maintain those treatment results.
So Profilo treatment is one of our newest treatment. I just noticed the typo. It's spelt with an F, not a P. We'll get that sorted out next time. But this is what I've had in my neck and my face that I was just talking about. I don't really talk about my own treatments, and Angela's had it as well. And it's revolutionary in that it's a beneath the skin rejuvenation treatment. And it is hyaluronic acid. However, it's not stabilized in the manufacturing process in the same way, because it's meant to stimulate the production of collagen and elastin to give firmer, springy skin. Now, I'm at 3 weeks from my Profilo maintenance treatment that Angela did for me 3 weeks ago, and I'm beginning to feel definitely in a more uniform way, ever so slightly springier. No volumes, it's not for volume. So it gently, we put gently volumizers, but it's not volumizing as in the same way as dermal fillers. It's more making something feel a bit bouncier.
Yeah.
And so it hydrates dull sagging skin, that's me, and it gives you a radiant young glow and restores firmness. And I can't speak more highly how pleased I am with it. And this is something that is a good entry level for people who say, I don't really want Botox or fillers just yet, but I do know that I want to look younger and do something for my skin that's a little bit longer lasting than a facial.
From my, I think our patient cohort that I use Profilo across my patients, but for my patients that have come to me and we have a little bit of Botox where they're starting to notice their fine lines and wrinkles. Zoom is the worst culprit for that, especially this last year. But they're really kind of sick of staring at themselves and just seeing them age, but equally they don't want to look done, is the most common say. I don't want to look done, Ange. And we do a very subtle amount of Botox to soften a frown or soften a forehead, depending on the patient's request. And then I hydrate the skin, and it just gives them this dewy, healthy glow, softens those really fine lines that are coming up, and it's a beautiful treatment for just that. But equally, our more mature patients, and I use that word broadly, but our more mature patients, when you have skin that we can plump and lift with dermal filler, but that very superficial skin where you just have those very superficial lines, the most natural way to soften it, and the quickest really, is Profilo. And I love it for just that.
And we like to do it in combination. Don't know, you just said that.
Yeah.
But you know, we do all of it at once, over 3 stages. So if you fancy a bit of it all works well, and it does all have a great effect.
And we do a lot of it on necks. I've been talking a lot to patients recently about necks, and Profilo is one of the biggest treatments that we are doing to just help with that thin neck skin and the crepiness. Now, we can't do this, we can't pull, that is surgery, but we can certainly hydrate and soften and plump that little bit of crepey skin under the neck in a natural, non-surgical way. And this would be the key ingredient for that key product.
So we're now moving away from injectables to the role of light, heat and energy, which is the additional treatment that we will add into a treatment plan for the Qutis non-surgical facelift. So intense pulsed light is something that I and the Qutis Clinic group, we've had about 20 years experience with it. And we use intense pulsed light to get rid of sun damage, brown pigment, and to get rid of red broken veins, which can equally also be caused by sun damage, or rosacea, like an inflammatory condition, or just being of Celtic skin. And radiofrequency is the heat treatment that we use that will lighten your skin and tighten your skin. It's very pleasurable. We put these as add-ons into our hydrofacial. And you have to remember that the skin is like the tablecloth and the skull is like the table. So we want to iron out the tablecloth and keep it clear from blemishes so that we give you a final polished look once we've lifted your skin. It's important that we look at all the different levels of what we can do, you know, the deep lifting, the muscle quietening, and then the complexion. So we can keep up this lovely light and bright look by regular intense pulse light and radiofrequency, or even laser resurfacing in our hydrofacial medical facials. And quite often when we're doing the treatment planning, we'll do maybe 1 Botox and 6 dermal fillers and 2 hydrofacials in that plan, the opening plan for you, whereby you have got your year's treatment and you've also got the how to keep the complexion looking light and bright. You may wish to have more hydrofacials than 2. We do have people that have them monthly.
Yeah, absolutely. Intense pulse light is I always say it, but it's my favorite treatment. It's not the nicest to have in terms of it can be a bit sharp. The results are the most natural, and just cleaning up the complexion is such a really nice way to either start or finish your journey with our treatment planning.
So why Qutis and why our clinics? Well, we have some of the most experienced and skilled specialist nurse practitioners in the country. So I started in about 1997, 1996, and since then, at that time, there were very few nurse practitioners that were doing, in those days, it was collagen injections. That definitely did have animal in it. It was from cowhide. But we don't do collagen injections anymore, but we started to work with plastic surgeons way back then, and then felt as a leading group of nurses confident and competent enough to go out and start in our own independent nurse-led practices. So senior nurses have got some of the best competency skills in facial injections, and also people skills in really listening and knowing what you want. Check out our Google reviews. We're always being complimented on them. And whilst we know it's not just a Google review driven way to get to us, just have a look at what we have there. We also offer out of hours service. So if you're a bit concerned that your swelling isn't going down as fast as you thought you were told it would, then you can text us and just say, hey Ange, hey Maria, it's still a bit swollen and it's day 3. Is that normal? And we'll come back to you and say, you did the right thing to text us. Don't Google anything, text us. We're holding your hand all the way through this journey. And that's what I hope is what part of our difference. We also have interest-free payment plans, which will help spread the cost of your payment over 11 months. Yeah. So here is our gallery, and it can be found on our website as well, our gallery for non-surgical facelift. And this is Christine. She is one of our patient ambassadors. We love her, and I think she loves us. We've got a great relationship with her. She's watching right now. And when Christine came to us, she had just gotten over being unwell, and she knew that she was better, but she wanted her face to portray this recovery, and she felt it didn't. So Christine had a non-surgical facelift with us, and on the left photograph is her before, and on the right is her after. And I'm sure you'll agree, it's completely changed her look. Thanks for letting us use that, Christine. Oh, and this is her now speaking. A video. I think from memory you have to go to the link.
Yeah. Bear with me.
So shall I just talk?
Do.
Yeah. So Christine felt so strongly about how much it had improved her well-being and the way and her confidence that she volunteered to sit and be interviewed by me this video that you're about to see. It's just a few minutes long.
Can you explain her treatment journey, Maria?
Yeah. So she was consulted, went away to think about it, came back, and we started phase 1, which was dermal fillers and some Botox. And then she came back again, and a third time, and she finished with hydrofacial, which she still has, and some skin tightening, which she's a big fan of. She is also one of these converts to clinical skincare. I think if you scroll, you'll find it. You'll find it. Excuse us.
I'm so sorry. It usually goes straight to it, but I just need to find the link. So bear with us one moment. I think going back to what Maria is saying, when it comes to our non-surgicals, as we said at the beginning, it is a journey. So it's usually 2 to 3 treatments.
You could play this one. Apologies, Christine, we can't find your video, but we do have another one, which we'll put in. Yeah.
So when I came for my first consultation in person, having spoken to Maria on Zoom about my initial concerns, we certainly addressed what I wanted, which I had these lines here, and having been staring at Zoom for the last 6 months constantly, not just the camera on Zoom, but your reflection on the black screen of a laptop, I was really concerned that I was starting to get sort of Labrador jowls down here, and that really worried me. But having spoken to you, Maria, and then what I wanted, and I think what I described is I want to look like the girl next door. I don't wear a lot of makeup. I want to grow up gracefully. I just want to sort of take off a few years, and this particularly was bothering me. So you suggested that I have a laser light treatment. I don't know what that's called properly. And that would get rid of the pigmentation on my skin, which I just thought was sunspots. My dad has them, he's 70 plus, they never bothered me. I always put that down to sort of advanced freckles, if you like. But I'm so glad you did, because the overall results of what we've achieved, yes, we've addressed this, but now I have this clearer complexion, which makes me look, I feel like a Barbie doll when I look in the mirror, because I have the skin of like a plastic doll. It's amazing. And then a little bit of Botox just to flatten my brow slightly, but it's not paralysed it. It still looks very natural. And also you suggested some under eye treatment here, because I hadn't realised that there was a slight sinkage there, which I probably wouldn't have realised. But with the Botox, with the light treatment, with the fillers that you gave me, I think I got the perfect results. And I came, I think, in total 3 times. So the initial fillers and the Botox, then I came for some light treatment, then I came back for a little bit more for my final dosage, if you like, because I bought the non-surgical facelift. So I had that credit if you want to use. And you suggested that we do this slightly more, just to get that final effect. And it was perfect. Honestly, I couldn't be happier with how I've come out. I feel like I look incredibly natural. Nothing looks fake on me as far as I'm concerned. And I'm really, really pleased with the result.
And she looks fantastic as well. It's a really great result from her, isn't it?
It's a typical patient journey.
Yeah.
And here's Alison again. We didn't show you the side views. So for those of you who joined late, Alison had a non-surgical facelift following getting to the age where she wanted to build herself up. Time for her. She felt that she'd given a lot to her family, to her job, and to her husband. She was divorced by this time. And, you know, she started dating again, had a little bit of a foxy set step, and she felt a lot better. And I'm sure you'll agree that the right-hand picture shows a really great result. Maybe want to talk about this one.
So this is another non-surgical facelift patient. The after photos are 4 weeks post her initial treatment and directly after her second stage. So she's just had her second stage treatment. So this is the same treatment session. So that gives you an idea of what you can expect to look like right after treatment. And her goal again was just like all the rest of our patients were discussing today, which was a natural look, but to just look a bit fresher. Again, this patient had quite a treatment, quite a journey before she even got to us. Nothing to do with treatment, but just life. And she said she wanted to look in the mirror and not see her grief. That was her goal. She was really self-conscious of feeling superficial about having treatment.
Yeah.
She was like, I'm not a vain person. I just need to do something for myself, but I don't want to see the last few years when I look in the mirror. And that was our treatment goal. And if you look at the lower half and then the upper half of her face, it was literally to look less angry and less sad. And we achieved that. And again, she was really, really pleased. This is an example of eyes, what we can do for eyes. And again, both of these after photos, which are the lower set of photos, are 2 to 3 weeks post-treatment. So typically when we treat the tear trough area, I would review my patient at a minimum of 3 weeks, but my favorable number is 4 to 5 weeks post-treatment, where we review and then potentially treat more. And I'd also like to say, when we discuss the eye area for treatment, we don't put needles when we're discussing filler into the eye area. It is something that's going into the skin, but it's a much gentler method that we use. So to just kind of relax anybody who has worries, it's not a needle directly in that area.
And this is someone who didn't go for a non-surgical facelift, but just has been coming to us for something like 14 years, I think, something like that. So the one on the left is what she looked like when she came to us 14 years ago. And the one on the right is where she's an aficionado. She comes regularly. And the one on the right is her 14 years later. And you can make your own minds up of which you think looks younger, but her skin looks tip-top health.
It does.
Nowadays. Before, you know, we've done many things with her. Dermal fillers, Botox, hydrofacial, those sorts of things.
Yes, but again, it was just to maintain that fresh look, and it's actually, from the photos, had a reverse impact, which is brilliant. Makes her look younger.
And this is someone who had sought the advice of a facial-maxillary surgeon because she had a backward-facing chin, which caused her to have this shape around here. Now, anybody that's been to see anybody for facial maxillary work, you know that your jaw has to be broken and wired. And this understandably did not appeal to her. And we were able to do all of this with fillers. Quite a few treatments, maybe 4 or 5 in stages, but it changed her look so much. Yeah. And this is just a non-surgical rhinoplasty. Now that means a nose injection, or a rhinoplasty means correction of nose. So this wonderful patient of ours, she has what is called a dorsal hump here. And what we do is we just inject above it. We don't do surgery, we just do a little bit of magic injecting just above it to make it look straighter and less bumpy. So we can do that. And this is someone whose chin we put forward as well.
Yeah, I did. I did her chin and jawline, and again, it was, you can see from the alignment of the nose and the ear that we've not done any camera trickery, but it was literally to just naturally elongate the jawline and the chin to just sharpen up everything for her.
Can I ask a question? I can't remember. Did she have any Coolsculpting underneath here?
She didn't actually, this
But
patient.
it might be
in
worth
particular.
talking about what you could do.
So when we're talking about lower face, I can in fact minimize the pocket of fat here through a treatment called Coolsculpting, which we run separate events on, but I'll briefly touch on it. So I reduce the pocket of fat in this area, which instantly elongates and sharpens the jawline, as well as lifting the neck skin. It does have a sort of tightening impact because it takes away the weight there. And then we finish with dermal filler, if needed on the chin area, and certainly on the jawline area to just lift, and that helps with the jowl. Again, eyes. This patient, this is 4 weeks post the patient's first treatment. Sometimes we do tear troughs, we call it tear troughs, in 2 stages. This patient, upon review, didn't need a second stage. And this photo is over 18 months old, her post-treatment photo, and she still hasn't needed her under eye area retreated. She's in her mid-30s, to give you an idea of age as well.
Lips. We tend to do natural lips, but of course we do all age groups from 18 to 80. And younger people generally want to have bigger lips. Believe you me, we prefer to keep to the golden ratio proportions, which is a proven scientific ratio. But the fashion is for some people to want 50-50 lips. So normally speaking, your top lip is always a little bit less in volume than your bottom lip. And that's the ratio we prefer to stick to. But sometimes people do come and ask for something that's a bit different. And providing it's safe, we can do that as well. And this is another non-surgical facelift. This person's backstory is interesting. She was a sales manager for a medical pharmaceutical organization and a triathlete, and ran, was always running, but it meant that her skin was very lean and she'd sort of got rid of all the facial fat. And while she was really happy and she looked great in her body, she wasn't happy with her face. So this is what we can do to somebody who's got.
So I'm going to open the chat room up now for any questions. So if anyone has any questions, please don't hesitate to just fill in at the bottom of the screen. If you hover over, you'll see the option for chat. And if you just type in any questions, we can reply to them straight away. So I have one here. And I think, again, it's a recap. Have we recorded this? And we have, yes. So as I said at the beginning, I will email this to everyone who's registered for the event. And we will share the recording with you so you can fast forward, pause, go back. And that will be available to rewatch across the weekend, probably until Monday morning, I believe, or end of Sunday night. Another question, Maria, and I'll let you take this one. How do you know what to do on each patient?
Well, that's a really good question. How do I know? So 25 years of experience, and your 10 years of experience, the qualification. We study anatomy and physiology almost at junior doctor level, which involves us going into mortuaries. And you asked the question, so I'm going to answer it. And we're constantly studying different types of anatomy and physiology, and different things. Like during the lockdown closure, we did a psychological aspects certification on the psychological aspects of appearance, so that we can evaluate someone's psychology as well as what we see. So it's experience, qualification and training. I'm an artist, so I went to art school before I studied nursing, and I still paint and visit art galleries. You love art as well. So we've got an aesthetic eye. Would you add to that?
No, I think that's it. And how do we know what to do on each patient is, again, it's about the journey that we discussed. So it's really about what your treatment goals are and why you've come to see us. And then we work out a treatment plan from there. So it's very collaborative between patient and practitioner. So it's not just us looking and saying, this is what you need. It's our advice, of course, but you kind of present to us with how you're feeling.
That's really important.
Very important, yeah. So another question, and it's regarding looking lumpy. So having injectables and looking lumpy post-treatment.
Yeah. It's a natural thing that you will look lumpy for the first week, maybe a few days. Some people manage to avoid it, maybe a few days. But basically, if your body's working properly, your immune system will flood the area with immune fluids. And as soon as it's been exposed to different types of filler, it will get less over time. But your body's working and it's an immune response and it will go down. However, we don't want to see lumps. Feeling it is okay because we know that that's going to happen. We also know that the hyaluronic acid will integrate like being stitched into the matrix of the skin. However, if it bothers you and it's not gone away and it can be seen, then come back and we can dissolve it. Now, that takes a patch test and it's a prescription, but fillers are, reversible. We can reverse fillers if that is what is the answer. But on the whole, sitting back, being patient, applying massage usually does the trick. Is there anything you want to add?
No, I think the word lumpy can be scary, especially for people who are new to aesthetic treatments. Lumpy is not something we see. Lumpy can happen directly after treatment because, like Maria just said, it's swelling. So it's not the treatment that's lumpy or the filler that's lumpy. It's the swelling that happens from the actual treatment, a needle going into the skin. Although superficial, you can get swelling and that can make the results look irregular, which is why we leave a minimum of 3 to 4 weeks between treatment sessions for this dermis and the body to rest and heal before we start the next treatment session so we can see the final results. So after I treat any of my patients, we say leave it at least 2 weeks, at a minimum of 2 weeks before you judge, if you like, the results, because it just needs to settle. We're tight on time right now, and I apologize for the technical errors during this presentation. Like I said, I will share this with you all, and I'll send you an email with an invitation to book a consultation with Maria. That will be offered virtually, and that's free of charge for anyone who's joined this event, and I'll give you a code in the email to do that. Thank you very much for joining us and taking time out of your day.
It's really great to see so many people. So thank you from all of us at Qutis.
Yeah.
If you see Paula, she's busy working in the Tame clinic, and Andrew and I work on Thursdays in Hemel, but we have our days, and I'm sure you can email or get in contact with us if there's any other questions. So thank you for attending. Really appreciate it. Thank you.
Thank you.